Hello and welcome. Very good evening. Thanks for tuning in to this weekend edition of the Urban Debate. I am Afrida Ali. Our top focus at this hour on the gruesome and rather tragic incident that happened in a district hospital in Bhandara of Maharashtra. What we are going to look at, in fact, we are getting you exclusive footage, what we have accessed to show you where did the violations happen, where were the lapses, are the district health authorities responsible for it, are the hospital authorities responsible for it. What happened was 10 infants died in a fire that broke out in the sick intensive care unit of the Bhandara district hospital. That is the big story we are looking at, just to give our viewers an idea of how things panned out. Fire broke out in the outbound section of the hospital around 11:30 a.m. on, 1:30 a.m. on Saturday, on the wee hours of Saturday morning. At that time, there were 2 nurses and a helper in the children's ward. They immediately raised an alarm. The fire brigade was called, but before it arrived, the staffers tried to rescue the children, managed to save 7 infants. There were 17 of them in that SICU. 7 of them could be saved only. The other 10 died, mostly what we are now told, through asphyxiation. Rescue efforts were affected by continuous explosions inside the wards. The staffers who were on duty could not rescue all the infants. Most newborns, like I said, died because of suffocation. 1 baby had fatal burn injuries and 2 others had minor burn injuries. The rest all inhaled smoke. Now, remember, the injured infants are also undergoing treatment right now because they have also inhaled a lot of that toxic fume, which one can imagine would be absolutely dangerous for a newborn infant's lungs to actually inhale. Let me introduce my guests this evening. Tuhin, leader of the BJP, joining us here on Mirror Now. Welcome, Mr. Sinha. Thanks for giving us your time. I also have with me here Dr. Suraina Malhotra, spokesperson of the NCP, also making her debut on Urban Debate on Mirror Now. Dr. Malhotra, thanks for joining us on this conversation. I want to begin with you, actually, Dr. Malhotra, since you are representing NCP, the health minister of Maharashtra comes from your party. A couple of things are glaring in this. A, an inquiry was set up immediately, and who should get the responsibility? The very health secretary in Bhandara, who was given the responsibility of clearing a fire installation project that has been pending for the last 7 months. So my question to you is that could this have been averted if the health department in the district took it rather seriously? And then you have the same person, and he had to be, of course, removed, and now the district commissioner is looking after the inquiry. But this just goes to show how primary health, neonatal health care is simply not a priority for the Maha-Aghadi government.
See, that is not true. First of all, I would like to start this debate by offering my condolences to the parents of the deceased children. I mean, it is a really a very, very unfortunate incident, and it's a really gut-wrenching thing. And luckily, 7 infants were saved. Now, this is a time which is a corona time, and this time is such that, sorry, I cannot hear you properly.
Carry on, Dr. Malhotra.
Yes. So
no, I'm able to hear you, Dr. Malhotra. Please carry on.
Okay. See, basically, the Mahavikas Aghadi government has swung into action, and immediately CM Uddav Thackeray has visited the place. He has offered his condolences. He has offered 5 lakh rupees on immediate basis, and of course, he set up a committee. The inquiry has to be done in this case. I mean, whosoever is guilty, what are the lapses are there, they have to be properly seen, and definitely, if there are lapses, if there is somebody who is responsible for the negligence, will be definitely punished in these cases. And of course, we have gone through a time which was a very tiring time, which was a very time which was a COVID. You all know that how COVID-19 progressed and how the pandemic, was affecting the healthcare. Every healthcare was on their
So what has this got to do with the pandemic? First, the health minister, Dr. Malhotra, in his first reaction says that there was a smoke, there was a short circuit. Then the electricity department, your energy minister gives a clean sheet to the Maharashtra State Electricity Distribution Company saying this has got nothing to do with any electricity lapse. So clearly there isn't a clear statement coming, and it's too soon, too premature to give a clean sheet, frankly, to the energy and the electricity department. I'm going to go across to Tuhin Sinha and I'll allow you to respond. But first, I actually want to play out this entire expose, the sting operation and the exclusive footage that the Times Network has with regards to how things worked out and what were the lapses. Let's just quickly take a look at that.
आपको क्या लगता है कि इसमें लापरवाही सबसे बड़ी कहाँ पे हुई होगी?
लापरवाही सबसे बड़ी ये हो गई उसमें कि जो फायर में जो आता है जैसा धुएं से अलार्म करता है वो चीज़ वहाँ लगी नहीं थी।
अच्छा,
सबसे मेन बात लापरवाही। धुआं निकल जाता, सायरन बज जाता था, इतना बड़ा हादसा होता नहीं था, कोई भी बच्चों डेथ नहीं होता। ये सिर्फ एक चीज़ से। और दूसरा बोलो तो बाकी वहाँ कोई फायर लाइन भी नहीं है वहाँ पे।
वो आप मेरे को ये जो बता रहे थे कि सिस्टर का कितने दूर रहता है?
सिस्टर का आपको बताया
हाँ।
कि कम से कम सिस्टर का दूरी नहीं बोलो तो एक 30 फीट की दूरी रहती है।
मतलब वार्ड से?
हाँ, वार्ड से।
तो वार्ड के अंदर कोई नहीं रहता?
वार्ड के अंदर में कोई नहीं रहता, बच्चे रहते और ये लोग इधर रहते। वो सिर्फ एक दिन के टाइम में वहाँ बैठते, वार्ड के सामने बाजू में टेबल है वहाँ।
हाँ।
बाकी अदरवाइज आगे में एक टेबल है, वो टेबल पे बैठे।
तो रात के टाइम?
रात के टाइम में अभी वो इतने बजे तो सोए होंगे।
हाँ, अपने अपने कमरे में
सोए होंगे, तभी तो इतना बड़ा हादसा हुआ।
हाँ।
नहीं तो एकदम से तो इतनी आग नहीं लगने वाली थी। जो कुछ दिखाई न दे, आग तो है धीरे धीरे लगेगी। इतनी आग लगने के बाद में जब उनको महसूस हुआ, धुआं दिखा, तब जाके वो जाग गए। अभी
जागे भी तो दूसरी जगह जागे होंगे ना, क्योंकि अगर वहीं पे अगर सोए होते
वहाँ नहीं थे।
हाँ,
तो एक्चुअली 100% इधर ही थे। अभी बोल तो नहीं सकते अपन कि ये वहाँ थे। हमको मालूम है कि यहाँ हॉस्पिटल में कोई भी वार्ड में चले जाओ, वार्ड में कोई भी सोता नहीं है, अपने कमरे में जाके सोता है।
कमरा उनका लिए अलग से कमरा है क्या कुछ?
आपको बताता हूँ, कोई भी वार्ड होता है।
हाँ।
उस वार्ड में खाली पूरा टोटल सिंगल वार्ड रहता है, पलंग बेड लगे रहते हैं। जैसा अटेंडेंट में लेडीज़ दिया जाता है तो लेडीज़ भी अंदर ही सोती है जहाँ सिस्टर सोती है।
अच्छा।
सिस्टर वहाँ, अटेंडेंट भी वहाँ। कब कुछ कम ज़्यादा होता है तो दरवाज़ा ठोकेंगे तब वो बाहर निकलते हैं।
Tuhin Sinha, we have done extensive coverage, in-depth coverage, and our reporters were on ground talking to eyewitnesses. Who do you think is responsible? Who should be pulled up for this criminal negligence that led to the tragic death of 10 infants in Bhandara?
Well, Afrida, unfortunately, the Aghadi government has a very casual and leisurely attitude towards healthcare. We saw it through the COVID months, where, in fact, your channel has played some of the footages of hospitals in Mumbai during April, May, and June, where dead bodies were lying alongside COVID patients. So the same apathy extends across the state. And what is really unfortunate is that even 42 hours after this most heart-wrenching and most unpardonable incident, not a single FIR has been filed. The hospital has not been asked to sack or to suspend anybody. This really shows the apathy. What do you mean when what does the CM really mean when he comes out and says a safety audit will be conducted across the state? The very fact that the
Tuhin Sinha, when the government representatives visited the location, and among them Praful Patel, senior leader of the NCP, what he has to say is that the current government cannot take the entire responsibility. The previous governments are also equally culpable. In fact, to use his words, he says previous governments also involved in this, and we should rectify the mistakes. So what it appears is the NCP or the Maha-Aghadi government is not willing to take full responsibility or the sole responsibility for the wretched healthcare system, as you put it, in Maharashtra.
So my esteemed, panelist from the NCP said that due to the pandemic, the hospitals have been burdened. But mind you, it's been 10 months, and the pandemic has been an opportunity to at least spruce up basic safety measures, considering that most of the hospitals have been full. So the very fact that this is a stay-at-home government, we have a stay-at-home CM. In fact, I can put this on record that had it not been for Devendraji visiting Bhandara yesterday, the CM would not have visited it today. So I think, the CM needs to take onus, the CM needs to take responsibility instead of the leader of opposition touring the state during and trying to access the situation, COVID situation, the flood situation. I think the CM needs to be doing that more.
Okay, Dr. Malhotra, your response to that. Tuhin Sinha has used the phrase stay at home for your government, that you're not proactive enough. You do not have your boots on the ground. And the CM, as an afterthought, visited after the former Chief Minister Devendra Fadnavis did.
No, that is not true. CM has definitely visited, and he has also come forward immediately. He has swung into action immediately, and our Deputy CM Ajit Dada has also responded, and immediately, as we said, the 5 lakh rupees were also offered, and immediately the main thing is that the committee has been formed, and whatever the charges and all, the committee will look into it very properly. Dr. Sanjeev Kumar has also been appointed, and also they have appointed the people from FIR, retired FIR officials who have the great knowledge of everything.
Dr. Malhotra, as a medical practitioner, you would understand the seriousness of this. We are not concerned of the committees at the moment. We are looking at why the lapses were there in the first place. We are running the number of lapses that we have found in our coverage of this story. Fire safety norms were not followed by this hospital, by this district hospital, a state-run hospital. Otherwise, this incident would not have happened. And who should take responsibility for that? Is the Maha Aghadi government even serious about healthcare? I want to ask you another question. 36 hours on, where is the accountability? Is the responsibility being fixed anywhere? There is no FIR. There is no arrest. There is no one who's being pulled up in the hospital authorities. Can they really shirk off responsibility, saying under their watch 10 infants died? Can they simply shift the blame to the health secretary and say that he did not clear a proposal? That is not acceptable. Somebody has to take responsibility from the hospital authorities.
The responsibility definitely lies with the hospital authorities, and that is what the committee is going to decide. Exactly who is the one to blame. And definitely this fire audit and all that should have been done by the earlier government also. And it is a responsibility lies with them also. Why wasn't all this done before?
Right. Tuhin Sinha, you want to respond to that?
Where does the question of the previous government come? I mean, do they not believe they are in government yet? It's been 14 months. My simple query is that this is an act of criminal negligence. How can you leave the onus of deciding where was the lapse entirely upon the hospital? Considering that the hospital authorities are the biggest culprit over here. So the least that the government could have done was filed an FIR for criminal negligence against select people or against the entire hospital. Now, I was on a show one hour back, Afrida, on your sister channel, and in fact, the Shiv Sena representative challenged the anchor of Times now, saying that an FIR has been filed. Now, I have never seen such a secretive FIR. When he was asked what are the relevant sections of IPC, he said it is under some section of IPC under which inquiry is being done. So, is this the level of knowledge? And I think when I said stay at home, let me give this credit to NCP. The NCP ministers Ajit Pawar and the senior leader Sharad Pawar are the only two people who are probably not stay at home. So I don't see why NCP should take offense. But the fact is, this is a rather sleepy government. This is a rather irresponsible government, which has very little idea of how things work on the ground.
That is absolutely not true. We have seen during the COVID time.
Sinha,
has been very proactive, has been coming up with so many things. COVID-19 was something very new, and this government, as it came into power, and it was challenged by such a big, humongous problem. And step by step, our Arogya Mantri, the Health Minister, State Health Minister Rajesh Topeji, and Uddav Thackeray, all of them together have always thought about the people, and step by step they have tried to take do different things and try to take the proper charge. And now, as you all know, that death rate is only 1%.
10 infants have lost their lives. Can you even imagine, Dr. Malhotra, what the families of these infants are going through at this moment in time, even as you and me are speaking about this? This is a tragedy of immense proportion, and we cannot have a country where you snuff out lives out of newborn babies before they even have a chance at life. I'm actually personally quite aggrieved to see that incident after incident of infant mortality has happened, and this is not even because of malnutrition, etc. That's a separate topic altogether. Carelessness, medical negligence, hospital fires, roof collapse. These kind of incidents have taken the lives of newborn, and this is not the first incident, and therefore it's important to ask this question: are the government, whether at the state or the center, I don't care, but are the governments, the elected governments, serious enough? If they were, because this is not just happening in Maharashtra, it has happened in other states. In Gujarat, in fact, the rural infant mortality rate is very high. So the seriousness that I was talking about, that is not seen in the health departments, and that is where we have to continue to question the governments. I want to play out some of the reactions we have from the families. Let's just face up to this. Let's see the faces of the parents, of the families, what they are going through. This is also extremely significant. Let's hear them out.
हम लोगों को कुछ मालूम नहीं था, पूरा धुआं हो गया था, आग लगी थी, आईसीयू में आग लगी थी।
जब आग लगी उस समय आप कहाँ थे?
हम अपने वार्ड में थे, अपने कमरे में थे, कोई बताने के लिए नहीं आया। वो आग पूरा पसर गया था ना, हमारे बच्चों आईसीयू में थे, तो मैं उधर गई थी, आईसीयू में अपने बच्चों को लाने गई थी, तो उन लोगों ने हमको आने नहीं दिया, बाहर भेज दिए। तभी सुबह हमको पता चला कि हमारा बच्चों नहीं रहा।
Right, so I have time just about for the final comments from both the panelists. Tuhin, Sinha, I was talking about how the thrust, the priority is extremely important. It's not about one state or the other. It's not about one party or the other. But I must say that the entire approach should flow from the top, from the center. How much are we willing to invest to prioritize neonatal care, for instance? India is still a country with, let me tell you, very high number of infant mortality rates, even though we have improved over the years. But I think the current figure, if my research is correct, is somewhere around 44 per 1,000 live births. In 2016, this is the figure of India's infant mortality rate was 44 per 1,000 live births. 2017, the average is somewhere around 40 again per 1,000 live births. That many infants die anyway because of other reasons, malnutrition, complicated pregnancies, and then you have this issue. Tuhin, Sinha.
Afrida, if you check this data, the infant mortality rate has actually been coming down over the years. In the last 7 years, significantly, if you look, there has been
no, I admitted that. I said the figures have improved, but you still have a country where 44 newborns are dying in every 1,000 births.
With an act of gross irresponsibility which has taken place in Maharashtra, and as much as it might offend the Aghadi government, let me give a strong word of advice to the Aghadi government. The Aghadi government should draw some of its lessons from the UP government of Yogi ji. In Gorakhpur, if you remember, a similar situation had been taking place for years till 2017. And look at the turnaround which has been brought about. Now, not a single infant death takes place in that hospital, that defamed hospital, in the last 3 years. So I think instead of, they must take this sad situation, a very unfortunate situation, to turn things around. And instead of just setting up a committee, they must actually launch an action plan in the next few days to ensure that such a thing never happens again. But yes, it should start with filing an FIR. That should be done before the end of day today, in the next 2 hours.
But I would say that in Gorakhpur, it took 350...
Okay. Right. So,
yes, in Gorakhpur, it took around 357
okay,
deaths.
let's not go to Gorakhpur. We questioned the BJP strongly enough when that happened. I want to ask you, if you look at the violations that we are running in our graphics as well, Dr. Malhotra, what we see here is that since 2015, the sick newborn care unit that was functioning from 2015 underwent mock fire drill only once. It's supposed to be something that's done annually. That was not done. It was yet to conduct the audit in the hospital, in this particular district hospital, and this is of course one of those healthcare centers where more or less poor people would go to, because this is where they go to for, and therefore all the families that you see are people who probably cannot afford private healthcare. Also, the SNCU section had a fire extinguisher, but nobody knew how to use it. This is the level of apathy, Dr. Malhotra.
So these things have to be corrected. I mean, there's no second thought about that. And these fire drills and these have to be corrected. After all, the newborns are the future of our India, and a lot of efforts have to be done, have to be given over there. And whosoever was responsible, that has to be taken care. And here I would like to mention the role of a nurse who sort of tried to save 7 infants. She managed to save 7 infants. Savita Ishwar, I would say that she was like an Ishwar, she was like a god, and who sort of helped save at least 7. But unfortunately, they said that there were some explosions and they couldn't save 10 infants. So that was most unfortunate. But definitely, the things have to be learned from here. What was the mistake? What was the problem? It has to be taken care of. There is no second thought about that. Not even our government is definitely not.
Absolutely. Kudos to the nurse on duty who saved those 7 lives. But that still does not absolve the hospital authorities and the staff on duty from the kind of lapses that we have exposed and our correspondent Rakesh has exposed. The larger question we continue to ask is that is primary healthcare, neonatal healthcare an issue of enough seriousness for the current government? We have to continue to focus on these issues. This is about our children. This is about the future of this country. Thanks very much for joining us, Dr. Malhotra and Mr. Tuhin Sinha, for giving us your views.